It's really hard to know exactly what to look for. And most patients, how are they supposed to know how good a certain surgeon is, in the operating room or with treating patients? And so, of course, a lot of patients will start with reviews, whether they be on Google. Word of mouth is obviously a very big driver. Obviously asking a friend or a colleague or a family member if they've had a similar type procedure or injury, how the surgeon was in dealing with them, and obviously seeing their outcome. I've always told people, if they know if they have a family member in the industry, like as a nurse or certainly that works in the operating room, they could always ask that individual, if they've, seen a certain surgeon operate. In general, when you meet a surgeon, you'll obviously know if you get along with them, if you like what they're saying, if they seem confident, if they seem knowledgeable in the area. I think that probably the number one question to maybe ask your surgeon or, to kind of get addressed is how many surgeries that surgeon's performed, specifically the operation you're looking at. I do tell people, I think in certain of the more common conditions, I think your surgeon should probably do at least 100 of those a year. If it's a less common, obviously that number would be less, but I do think that that's a very good question that you could ask, is how many of these procedures do you typically perform in a year? I think you can also ask if they're board certified, because that just takes a level of oversight, and it's just it's a credentialing process where that there's a certain standard there. And then, you can ask them if they had a specialty training or, what their fellowship is in. Are they fellowship trained in a certain area? And so I think, between all three of those questions, you can get a pretty good sense of your surgeon's level of expertise in whatever area that you're dealing with.